Go ahead, Commissioner.
2,
Live.
1.
All right, good morning, everybody, and welcome to the, someone's talking? Okay, good morning and welcome to the Board of County Commissioners Agenda Setting Work Session for May 5th, 2020. And we'll start by way of introductions. I'm John Hutchings, the chair of the board, and at least on my screen, to my right, is Vice Chair Commissioner Ty Menser. Below him is Commissioner Gary Edwards, and to his left is going to be County Manager Ramiro Chavez. Upper left on my screen, I have no idea how these show up on your screens, but is Assistant County Manager Robin Campbell. Right below her is Public Health and Social Services Director Shelley Slaughter. The very bottom is Dr. Diana Yu, our Health Officer Extraordinaire. And right smack in the middle is Elizabeth Petrich, our Deputy Prosecuting Attorney. And I know we have on the line, we've got County Assessor Stephen Drew. Am I missing anybody, Ramiro?
I think you covered it, Commissioner.
Woo! All right, then let's get started. We're going to start with, I'm going to let people know that if you want to the phone in, you can listen. And Keely Marino, yay! Welcome, Keely. Start with the public attendance. If you want to attend via conference call, the phone number is 360-252-9020. Enter PIN number 1234. That's 360-252-9020. And your PIN is 1234. So now we're going to start with a COVID update, and I'm going to turn to Romero first to kind of put this in perspective.
Yeah, thank you, Commissioners. Thank you, Commissioner. Today, you're going to take this as an opportunity as part of the regular COVID-19 update. Shelley will walk you through the weekly update and larger perspective. And then Dr. Yu also will provide her feedback. But also, I'd like to take this opportunity to walk through the governor's proclamation that he issued yesterday. And within that proclamation, allows for some waiving opportunities for some counties in the state related to moving from phase 1 to phase 2 of his plan. And I believe Commissioner Edwards would like to have a conversation related to that. So when we get to that point, Commissioner, I will frame the issue a little more in detail, and I'll give you a perspective as to my interpretation of the governor's orders, as well as the opportunities or not the Thurston County may have in exercising the waiving, moving faster from phase 1 to phase 2.
Yeah, thank you for that. And you and I spoke as well and about this. I wanted to have a discussion just so we're all in concert with each other when it comes to decision making. So thank you for that. Anything else, Romero?
No, thank you.
Okay. So we'll start with.
Just one.
Yeah.
I'm sorry. One more thing. I know that we were waiting as part of the governor's proclamation. He needed to have a concurrence by the state legislature and what they call is the four corners of the legislature. That will be the majority and the minority leaders on both houses, the Senate and the House of the state legislature, to concur with some of the orders that he has established in the past. So last night we received what pertains to us among the many different waivers is the OPMA. Has been, some of the waivers on the OPMA requirements has been put in place until May 31st, 2020.
Okay. And I'll take that off my items to bring up. So good, thank you. All right, I'm going to ask Shelley, do you want to go first or should we let Dr. Dinah Yu begin?
I'll go first and provide the weekly data and update.
Okay, thank you.
Okay, I'll go ahead and get started with that. Good morning, commissioners and everyone. So to share the latest situation report and the latest available data that we have as of yesterday, May the 4th, in Washington State, there are 15,462 confirmed cases of COVID-19, 841 deaths. The testing test positive rate statewide is 7%. In Thurston County, we have 113 confirmed positive cases of COVID-19. We have had 1 death. 18 of those cases have been hospitalized in the course of their illness, and 104 are recovering. Our positive test rate is 2% in Thurston County, so that continues to be low. All zip codes in Thurston County currently have cases of COVID-19. We see the highest prevalence of COVID-19 in zip codes 98503, 98513, and 98501. Our hospital capacity is currently stable, and our supply chain for PPE is improving, continuing. And Director Carden will share his update on that. I was also asked to provide you some information on our flu surveillance data for the flu season as we begin to wrap up. The seasonal flu runs from October to May, and just wanted to share the information that we have as of to date. In Thurston County, during the flu season to date, there have been unfortunately 6 flu deaths. In Washington State, there have been 98 deaths. To compare that to COVID statewide, in the past 9 weeks, there has been 841 deaths due to COVID-19. Flu, we know that there is a vaccine and also there's treatment, and we know quite a lot about the seasonal flu. We do not currently have a flu pandemic. The hospital system is regularly stressed by the flu, so adding COVID-19 to that has been a concern. The death rate of the flu, or case fatality rate, is 0.1% on average, compared to COVID of 3.4%. Transmission rate, or R naught, of the flu is thought to be about 1.3, and COVID is thought to be about 3. So that just gives you a little bit of comparison between flu and COVID. Of course, these are 2 completely different viruses, with COVID-19 being a novel coronavirus that we are still learning a lot about. And with that, I'll take any questions and then pass it over to Dr. Yu.
Commissioner Menster, any questions?
What was that last statistic, Shelley, about 3 versus 0.3 or something between flu? I didn't catch what that was.
That's the R naught, or transmission rate. We've talked about it before. As for every 1 person that's confirmed to have it, how many other people are they likely to transmit the virus to?
Got it. And did I get those numbers right? 3 and 0.3? Is that what you said?
1.3. Oh. 1.3 for seasonal flu.
Okay.
So essentially, COVID-19 is more infectious.
Commissioner Edwards, any questions of Shelley?
No, sir.
Okay. Dr. Yu, do you want to go next, or would you prefer to defer to Kurt Harden?
Let me defer. I think, Shelley has kind of given you the numbers, and I think the input I have is more along where he's going to be talking about the governor's phases.
Okay, good. Thank you, ma'am.
Mm-hmm.
And thank you for hanging out with us. I appreciate that. Kurt Harden, Director of Emergency Management Services, are you on?
Yes, I am. Thank you very much. So first of all, I want to talk to the supply chain. When Shelley Slaughter indicated supply chain is improving. However, we are still not able to find sufficient PPE for tiers through tier 4. We got in some PPE this week, and that was a little bit lower than what's been we've gotten in past weeks. One of our challenges right now, and I think it's at the state, and it's with everybody who's trying to utilize PPE, as various industries reopen, they are scrambling to obtain PPE as well for their workers. An example is masks. So it's putting an additional strain on the supply chain. So what was improving a couple of weeks ago, we've seen plateau off because of more demand across the country. I will also say that we have been notified recently that FEMA is going to send PPE directly to skilled nursing facilities across the country, which includes 6 nursing facilities here in Thurston County. This is going to happen over the next 4 to 6 weeks. So we're trying to reach out to those nursing facilities to ensure they are aware that that's coming. We're still regarding PPE from the state. We submitted a series of questions approximately 2 weeks ago on how the state is going to move forward with distributing PPE to local jurisdictions. We're still awaiting answers on those questions. I did see that the Board of County Commissioners signed a letter to the governor yesterday requesting that the state not change policy on how they distribute PPE down to local jurisdictions in the middle of a pandemic. I appreciate that. Thank you. I circulated that letter to the other 39 counties in the state and a number of cities that have separate emergency management programs as well. I received a number of comments and feedback that others were going to try to push something up to the governor's office as well in support of what Thurston County was trying to do. So I will stop here and see if there's any questions regarding PPE and distribution of PPE at this time.
Commissioner Edwards, any questions of Kurt?
No.
Commissioner Menser?
No.
Okay, thank you, Kurt. Dr. Yu, anything yet? Okay. All right. So I'll turn back to Romero to lead us in discussion on some other related COVID-related type activity.
Yeah, thank you, Commissioner. So I have included in your packet a copy of the proclamation, the latest proclamation by Governor Gov Inslee, with also attachments to that. So I will walk you through the packet of information that I have provided to you. First of all is the proclamation of the governor extending and adjusting the stay-at-home order until May 31st, 2020. Within this order, I am not going to walk you through each of the language, but within this order, also he outlined a phased approach as to how he is planning to implement open up the economy in the state of Washington. So attached to that is a series of documents which starts with this purple document which says Safe Start Washington, a phased approach to recovery. So if you go back to page 6 of that attachment, then it walks you through the 4 different phases the governor is planning to implement in the upcoming weeks. Phase 1, among many things, it includes opening up essential businesses, existing construction that meets agreed upon criteria, landscaping, auto RV, boat in sales, retail, curbside pickup, orders only, car washes, and pet walkers. And then moves into phase 2, it gets a little more robust in terms of open and remaining of the manufacturing, additional construction phases, in-home domestic services, retail, in the store, as long as they find some restrictions, real estate, professional services, offices, as long as they continue to practice teleworking, hair salons, pet grooming, restaurants to less than 50% capacity, but tables no larger than 5. And then moves into phase 3, that's when the government, at least from his approach, is when customer facing for government offices start opening, that's when the economy may be in that situation. Also then moves into phase 4, which, pretty much everything is open as long as we continue to practice social distancing and some of the safety requirements as he has been stating. So, and again, I'm not going to walk you through each individual phases, but also within his order, he provided a variance for some counties as to how some counties could apply for a variance related to moving faster than what he is intended to do. And the variance is to move faster from phase 1 to phase 2. That's the only variance, as I understand, he has allowed to do. And 10 counties has been stated on that. Thurston County is not included in those 10 counties. So on the last part of your packet, there is a document from the Department of Health, and the title is COVID-19 County Variance Plan, moving from phase 1 to phase 2, is this one here. And a set of instructions. So I'm gonna just read you, and for the public's benefit, this background, and that will probably put the context as to perhaps how Thurston County is not included on this. This is just my perspective. And the background of this paragraph says on March 23rd, 2020, and subsequently after, Governor Inslee issued a state healthy proclamation prohibiting persons from leaving their homes or places of residence except for to conduct or participate in essential activities and or employment in essential business services. He also provided on March 25th, 2020, all non-essential business operations except for performing basic minimum operations. On May 1st, 2020, Governor Inslee indicated that he will extend the stay-at-home state health order through May 31st, and that he was allowing smaller counties that did not have a new case of COVID-19 reported in the last 3 weeks to apply for a variance that will allow them to move from phase 1 of the phased approach to reopening Washington to phase 2. This document provides instructions to counties with populations less than 75,000 and no COVID-19 cases in the last 3 weeks to apply for a variance. So, and that is the background. I think that puts a perspective, and then the rest of the document goes through the process as to what that variance should be applicable, what is the process will be, and I will stop there because I think that's probably framed the conversation. I believe Commissioner Edwards would like to have a discussion on this matter. He asked me that to bring this to your attention this morning. And again, at least from my point of view, the reason as to why the governor did not include Thurston County on the 10 counties that could apply for a variance is 2 elements. Thurston County has more than 75,000 population, and Thurston County has had COVID-19 cases in the last 3 weeks, which at least from my point of view, those are the 2 set of criteria in which a county can apply for a variance. And again, the variance is only to move from phase 1 to phase 2 in a faster approach. I'll stop there. Questions?
Hey, I'm Gary. Dr. Yu, you're still on hold?
Yeah, no. I think that this might be a good time for me to kind of talk a little bit about what the part of the readiness that all communities are expected to be at in order to kind of move forward. One is that the healthcare system is ready and available, so that means a hospital is available, that you don't have a hospital full, that you have ventilators available, ICU beds available. The second criteria is that there's testing capacity and availability within your county. So in the last week, I think we have, throughout our county, we have done about 900 tests for COVID. The expectation for our county, the size of our county, is that we need to be doing at least 500 tests a day. So we're not near there. I'm not sure that we have the capacity to do that. We are still checking to see what the total capacity is. We can certainly do more than 900 a day. 900 a week, but I'm not sure we can do 500 a day with the places that we've been doing testing with right now. The third criteria is that we have enough public health workforce, the case and contact investigators, and doing case management, and that we're able to do that. That we are able to do. There's no question in my mind. We have staff that's ready, willing, and able, and we have a good medical reserve corps that we've trained up, and that is available for us. And the fourth is the ability to protect the high-risk population. So far, we have done that by, encouraging people who are at high risk to stay home. We've also been doing a lot of work with our long-term care facilities to, give them guidance and monitoring and respond to potential illness or outbreaks if there is any out there. So all of this is also making sure, even with the phased approach, that the new normal for all of us is that we're going to practice social distancing, the 6 feet apart, hand washing, staying home when you're sick, covering your cough, and taking care of ourselves. That's going to be our new normal for a while until the virus disappears, or we get a vaccine, or we have available treatment, and that is anywhere, best estimates is about a year to 18 months from now. So I'll stop right there. Just kind of put it into context of what are the things that we need to be prepared for in order for us to be in a position where we can move forward to the next phase. And each phase is expected to last about 3 weeks. And then as things open up, we do expect and we are prepared to handle more cases. But if we are also testing more, we do expect to find more cases. But right now, the testing has been pretty much limited to people who have symptoms. So, and we're trying to make sure that people come in. Earlier on, we were telling people, if you don't need to be hospitalized, just stay home, and because you're gonna have to stay home. If you get very sick, come into the hospital, you get tested. Well, we're now at the position where we have testing supply, and we do want people to come in to be tested, because it is we are better able to control the disease if we know people who are ill are staying home. So I'm going to stop right there unless you have any questions.
I hope you're going to hang out with us longer, aren't you, Doc?
Yes, I will. Yeah.
Then I'm going to turn to Commissioner Gary Edwards to go ahead.
Shelley, how many currently do we have hospitalized that are under treatment?
I believe 1 or 2. One, Dr. Yu is saying 1.
Okay, I guess here's where I'm coming from on this. We've got 1 death, we've got 1 hospitalized, we've got several that are treating at home. We've got 300,000 citizens in Thurston County, and I believe that we could move on to phase 2. I don't know why that artificial barrier was put in place by the governor. I'm sure he's taking into consideration all the information he's getting from his professional health folks. And with all respect to Dr. Yu, I agree. She's doing a great job with keeping us advised. But the reality is we don't want to end up in a situation where the cure is going to kill us in the long run. I would venture to say we've had at least 4 suicides, according to the coroner, I believe, that were directly attributed to this COVID. So as people are struggling to get ahead, I would at least like to put in for a variance, even though we didn't meet whatever that artificial barrier was placed by the governor, because it's not even gonna happen overnight. As we continue to get better, let's get at the head of the line, even though we weren't named as one of those 10 counties. If you consider the cases that we have and how well we have controlled it, and the population being about 4 or 5 times more than all of those other counties, but our statistical information is very similar to them. I know the governor has the ultimate authority, I realize that. I don't always agree with the governor, but I'm sure he's got the citizens' interest at heart. But I just think we need to stand up for our citizens and see if we can't at least get some recognition to going to a phase 2 sooner than later, because I think we're handling the situation pretty well due to our healthcare professionals that we're working with. So I'm just gonna ask my seatmates to consider putting in for an adjustment to moving to phase 2 earlier.
Dr. Yu, go ahead.
So I think moving to not to argue with you, just there are two parts of what the governor is going to look at. That one is the hospital, the healthcare system readiness. And currently, our hospitals are doing a fairly good job of being available and keeping some ICU bed capacity open. One of the things that is opening up right now is surgery. Some surgical procedures are now going to be allowed, and that in general takes up the use of ventilators and intensive care beds if there are complications. So we have to, over the next week or two, as surgeries start happening, we need to continue to keep track on the availability for our hospitals. And then the other piece is really increasing testing. We have not yet gotten to the level where we are testing enough, per their assessment of how many we should be doing. I would suspect that even with testing more, we've always been at that 2% rate. And we have done very well, and we've had a number of days where we've had 0 cases, but where our peak was about 6 or 7 cases a day has now come down to, an average of 1 to 2 a day. Occasionally we'll have 3 and then we'll have 0. So it's not going away. It's just kind of a low level. And I agree, we are doing well. There's some things that we can do better. So I'll stop right there.
Hutch,
Yeah, go ahead, Gary.
just to follow up on that, I know your heart is in the right place, doctor, and I respect that. It's just that we are in a situation where we have to come up with a balance. And even in the worst predictions that were given for New York City and Seattle, where we put field hospitals in place and really ramped up, if you will, it wasn't needed in the end. And I'm not saying that we haven't, I think we need to continue protecting our individuals that are in that demographic of risk, whether they have pre-existing conditions or their age. I think we have been fairly well educated by now as a society on how to separate from those folks, and some of us can still go back and start to get carrying on a normal life, which we don't know what normal is going to be. But I do think we are obligated to try and come up with a balance from our perspective of balancing the health of the community and the economic welfare of those individuals. And if you just compared the suicides that we've had,
Right.
that's already overriding. So that's my argument. I would like to have my seatmates sign with me in making this application.
I would like to say, who was talking?
Commissioner, if I may.
Yep.
Maybe before you engage on that conversation, allow me to walk you through some of the requirements of the process, just to have a broader perspective of your conversation. So I'm going to describe in two elements. On the variance, it speaks about the process. And it seems to be a local process. The first item, and there's starts with the local public health officer must be submitting and sign the recommendation to the Board of Health, requesting the variance to move to phase 1 to phase 2. So the health officer needs to be involved in that. Then the next step is the Board of Health, the three of you, will have to, in a majority vote, concur with the health officer recommendations and vote on requesting the governor to move from phase 1 to phase 2. Item number 3, it says the local hospitals must submit a letter certifying that they have adequate bed capacity to serve their community and adequate personal protective equipment, PPE supplies, to keep their workers safe. And goes on to describe what the PPEs and how long supply they need to have on the hospital. So certification. The next step is the Board of County Commissioners, the three of you again, will have to vote and ratifying the Board of Health's variance request and the plan. So that's from the process point of view. Now, the information that you need to submit on the document itself, one is plans and identified resources to make COVID-19 testing available and accessible to everyone in the county, and that was what Dr. Liu stated to that effect. Number 2, number of COVID-19 tests performed in the county by week over the last 3 weeks. We have that information. The local health jurisdiction plans and resources to perform case investigation, contact tracing, using statewide standardized COVID-19 case and contact investigation protocols. I think we can attest to that as well. The next requirement will be plans and resources to house people in isolation or quarantine who do not have a home or wish to isolate or quarantine themselves outside of their home. And I believe we have a plan already to do that. Plans and resources to provide case management services to case and contacts in isolation and quarantine. That will be the support to those individuals who choose to quarantine and isolate outside of their homes. And lastly is plans and resources to rapidly respond to outbreaks in the community and within the congregated settings. So that's the document related as to what the requirements they will need to, if the board wants to submit a request to the governor, those are the elements that needs to be included on that variance.
Now, hang on, Gary. I'd like to say to Dr. Diana Yu or to everybody that Gary, you're right. She does have a big heart. However, she's not Dr. Phil, and she's a medical doctor and a researcher and a health officer and knows exactly what she's saying. And I don't think she's making her recommendations to scare people. And I don't think the governor is making rules and regulations to scare people. If you mentioned fear. And what I've seen in response to that is some negligent or reckless behavior, quite frankly, in the community. And I'd like to just refer to the back page of, well, number one, I'll tell you, the earth is not well. And I don't say that to scare anybody, but the earth is not well. And though people are living through hell right now, the worst thing, the last thing you want to do is serve ice cream in hell. That's not a good policy decision. And I'm sitting as not only Board of County Commissioners, but I sit on the Board of Health. So I have that push-pull also. And COVID-19 remains a significant health risk to all people, especially the most vulnerable population. Now, I'm not anti-commerce, I'm very pro-commerce, but I'm also pro-health and protecting our most vulnerable. And in the governor's proclamation, what he also mentions is that violators will be subject to criminal penalties. Yeah, okay, that's fine, you expect that. But he says he may be forced, depending on social distancing and how people are disregarding this order, he may be forced to reinstate prohibitions established in earlier proclamations. And so we've already had incidents in the county, within the county, not within the city limits. Sports teams coming together, coaches and kids and parents coming together for a baseball practice, rallies, demonstrations, behaviors at the parks, and now the parks are subject or the host again of the city, and other miscellaneous groups that threaten, perhaps for self-serving reasons, further restrictions on all of Washington State if the governor were to enact further restrictions or go backwards and not move forward. And but that also, it just presents a risk to everybody of further infection or a spike in COVID-19. And as the doctor said, or Shelley said, even though we know what we know, we're not testing sufficient people to know what we don't know. And there may be more infected folks out there. I like the analogy I read over the weekend that if you're jumping out of an airplane, you put your parachute on to slow the rate of descent. But at what point do you say, well, I've really slowed down quite a bit, I'm going to take the parachute off? You don't do that. So I'm not in favor of pushing ahead out of this phase yet, because I think we're still very vulnerable. And I'm acting as, like you said, with the hat of the Board of Health on right now, and going with the best recommendations of the national reports that we've been getting from the U.S. Department of Homeland Security and all of their interagency collaboration. Okay.
Well, it appears to me that we don't qualify to apply for a variance. We're not under 75,000 people. We don't have 3 weeks with no cases, and we don't have the recommendation of our public health officer, and those are all prerequisites. So it sounds like to me that the commissioner's request should be more about writing a letter to the governor to change the process that he laid out. Not that we should fit through a process we don't fit through. But at the end of the governor's guidance, he says, and he said it at his press conference, and it's here in black and white, in the next 2 weeks, the Department of Health and Governor Inslee will consider additional criteria, which could include cases per capita, for allowing other counties to apply for a variance. So we're going to get that guidance potentially, and then we may be in a position to follow through on Commissioner Edwards' request. We'll have to have that discussion at the time and make sure we have the recommendation of our health officer. I just would, point out that yesterday, the University of Washington modeling was revised, and the University of Washington modeling has been used across the country in a pretty alarming way, but a very telling way. It raised the projected death toll for the nation by 86%, from 72,000 to 134,000. That's 86% across the nation. Although Washington went down by 20%, from 1,450 to 1,150-ish. So the things that we're doing are making a huge difference, and we have data right there as to what happens when you don't follow the approach that we followed, because in the article that I read, the revised death toll was based on easing of restrictions and people's increasing mobility even where restrictions are in place. So we can see right there the positive effect of what we're doing. Their projected time for a reopening is early June. That's revised from late May, which was earlier revised from mid-May. So it is extending, but it's not extending far, and we're really doing a good job. And I want to be in that category of a lowering death toll, not an increasing death toll. I mean, if you think about it, if you take out the states that are reducing, like Washington, I'm not sure how many there are, that means in the states that aren't following these types of procedures, the death toll I'm sure is more than doubling, because it's an 86% revised increase across the country, including all states. So that to me kind of, tells me that we're on the right path. And if the governor wants to give us new guidance in the next 2 weeks for bigger counties, because I'm thrilled that we've had this slow number of new cases, but I think the state's doing a good job, and I will carefully look at that criteria for application for a variance once it's released, and it looks like we may be seeing that in the next 2 weeks. I'll look at that very carefully, but right now there's no reason to apply for something we don't qualify for.
Hang on, Gary. I just want to tell you, Gary, that you question authority, and I admire that because I question authority too. And I don't agree with everything the governor says either. And so I applaud your, this is what I wanted to discuss too, but I applaud your bringing it because it merits a good discussion. And I will also be keeping a keen eye on this. I've got several friends, close friends, that are negatively impacted because of lack of business, because of their business is closed or in threat of losing their business entirely. And it's a doggone tough call. And I question, I also look at the governor's proclamation and wonder if there's a weasel room. Is there a way that we can balance this out? Can you talk about balance? And I believe there's balance in everything. But I'm just not there just yet. But go ahead, Gary, you got the floor.
Okay, I guess maybe just to finish this topic up, because the democratic process is in play here. We're making sausage. It's always not pleasant to watch. Sometimes it's good in the outcome. But I believe those serious numbers coming out of the University of Washington are based on no mitigation to take effect. The other piece of that is even in the most serious situations in New York and Chicago, no one was denied a hospital bed. No one was denied a ventilator. We've been able to meet the criteria of need, even though it was the worst situation. And as far as artificial barriers that the governor has put in place, I think one of those is even considering what health officers, what their oath is. The actual oath from any of the doctors is do no harm. Well, that means almost like we're going to have to be in utopia in a perfect world to get to that point where we can balance out the economic well-being of our community to keep functioning and the do no harm aspect of it. So with all due respect to our doctor, I think, I say that again, her heart's in the right place. I think I know where she's coming from. I'm just trying to come up with balance. So I guess it sounds like we're going to move on from here to another discussion. Thank you very much to my seatmate.
Yes, sir. Go ahead, Doctor. Dr. Yu.
I think the one thing that we will be doing over the next 2 weeks is actually trying to ramp up on our testing, because I think that's one of the biggest pieces that's going to hinder us. I'm really comfortable with our cases and the numbers, and for our community our size, we have done very well. And I think that if we are able to do a lot more testing and continue to see the same kind of result, I think that would play into something that would continue to move us into the phases, and by then we will know. We really have to see what happens as it opens up. Maybe nothing. And my mind can change. It's not. It's not. It is. There is that very big balance with mental health and physical health, I personally have the effects of the isolation that affects a lot of people. And not everybody can get on Zoom and be in the virtual world. And there's a lot of our community that cannot do that either. So thank you for bringing it up. I think it makes for a good way to discuss the issues, and because they have set standards, we know where we need to go, and we are trying our best to get there. And it's for 75% of what they want, we're there and beyond. So, and if things change and we open up today and we see a lot more cases, we can handle it. We don't really want to see a lot more cases. because that would defeat the purpose, because it's not a minor illness, and you have people who end up getting very sick. They may not die, and they can have lifelong consequences. So, but we are keeping track on it, and if things change, we will bring it back up. Thank you for the opportunity.
Thank you, Doc. And I would just add that the governor has also been very flexible and open-minded. He's undone some of his previous decisions, and he's been open to the phasing in, not one size fits all, but phasing our economy back. And I'm not there, but I am almost there to support Gary to get this economy back and get to a new level of abnormal, whatever our new level of abnormal is going to be. But I just can't rush it at this point. But I'm glad it was brought up as a topic again. Any final thoughts, Ty? Go ahead.
I just wanted to ask, I'm not sure what Dr. Yu's morning is looking like, but like at the end of the agenda, we have the county parks issue. And if she's not going to be online, then I would love to have her input on that issue so that when we get there, we can take that into account.
Yeah,
Thank you for bringing that up, because we were going to talk about parks. Go ahead, Doc.
I was not planning to be staying for the whole meeting.
So let's move that agenda item right up. Is that all right with you, Romero? Does that make sense?
Yeah, that would be good.
Yeah. I didn't know if you had anything to prep that with.
No, and I think it was a request from Commissioner Edwards, considering the governor opened the state parks last week. And Commissioner Hutchins, you heard from the cities on this past Friday, all the city parks are going to be opening as well. So this item is up for discussion with the board, meaning whether the county parks should follow suit and be open for the citizens to enjoy that.
Right. And with that, of course, I passed by LBA Park this morning at about 8 o'clock, and it was open for the first time in quite a while, and cars were pulling in. Not a whole slew of cars, but a few cars were pulling in. So that's why I talked to you this morning about it, Romero, as well. We can have this discussion. Dr. Yu, or even Shelley?
Shelley, do you want to go first?
No, go ahead. Take it away, Dr. Yu.
Yeah, I have no heartburn with parks opening up. I think that people need to, again, follow their responsibility to make sure that they are staying far away from each other. The parks are open for individual use, not for group practices, not for dancing in the park, not for sports events. It is for individual use, so you can go out and take a walk in the park, run around, fly your kite. So the restrictions are still in place for group activities. I think hopefully people will remember and try to do that. I know it's difficult when you have young children and you bring them to a play structure. There are other kids. So making sure that there's hand washing available, people are washing their hands or using sanitizer after. Kids at the park need to be supervised. I think we can continue to put out messages about, the safety, personal safety. I'm not opposed to opening it up. I think people need to maintain that social distance. And that's all. Shelley, if you have anything else to add, or if you disagree.
I think that you covered it well, just emphasizing that social distancing is going to continue to be important, and there's adequate sanitation and the other things that Dr. Yu mentioned. Dr. Yu provided the elected officials and appointed directors and county manager with some interim guidance on plans for reopening of county facilities, and laid out some requirements. And I would say that should be a consideration about our park's ability to be able to meet those requirements, and of course for the citizens that are using the parks to adhere to that. And I believe that Director Walker will provide more information about that.
Yeah, and definitely do not go to the park when you're sick. Don't go out of your house when you're sick, so.
Well, I got what I needed out of that conversation. I'm not shutting it down though, but as long as there's distancing, masks, and group limits. But just as you said, Shelley, and we'll go to Jennifer, we can just flip a switch and say parks are open, but are we prepared to open them with staff, with the bathrooms, with the trash cans and such? Are we prepared to do that? Go ahead, Jennifer.
Thank you, Commissioners. Jennifer Walker, Public Works Director. So I would say, I'll let Carrie speak to the specifics, Carrie Hibden, the Parks Manager. But I would say that yes, we are prepared to open the parks facilities. I do want to remind the board that our current level of service when the parks facilities were open was that we cleaned the restrooms that we have 3 times per week. Once a day, 3 times. Can you hear me?
Yeah.
Yeah.
Okay, once a day, 3 times per week. So as we look to increasing those cleaning efforts based off of the recommendations from the public health officer, we have put a plan in place where we would be able to clean the restrooms twice a day, 7 days a week. Certainly as we do that, we are now pulling those resources from the clearing of trails and mowing and that type of thing. But we are prepared to do that. And we're prepared to put up even signage that talks about social distancing. Where we are running into some concern in terms of what the level of service is, being able to do a constant cleaning in those frequently touched areas. So we don't have the staff to have somebody basically stationed at the restrooms and cleaning them each time they're used. We also have not been able to get hand sanitizer yet into our porta potties that we do have set out on some of the trail areas. Carrie, do you want to add anything specifically to that?
No, I think that I'm comfortable with the fact that we've been having communications with the city parks department directors, and we're aware that they're opening their parks, basically mirroring the state process. I don't have a conclusive answer as to their restrooms, but my understanding at last conversations was they're not opening the restrooms. They're having questions about some parking lots, but they will be opening their parks as of today. And they have some pretty good signage going up, instructing people how to use the parks correctly, not gathering and so forth. Playgrounds, picnic shelters, and other gathering spots will be closed.
Okay, Dr. you were, looked like you had some commentary early on.
Yes, I would not be agreeable to opening parks without restrooms being open. I just don't think that's a good idea. But I'm going to defer to Shelley because I think she had a more animated face.
Okay. All right, go ahead.
Commissioner Edwards is been raising his hand, by the way.
Okay, as long as he's not touching his face. We'll go to Shelley and then we'll go to Gary.
I agree with Dr. Yu. I think that the restroom and sanitation and access to hand washing is critically important. And also, I'm glad to hear that the playground structures are not proposed to be open. While play is super important to children, and I have a young child myself who's just clamoring to play and move and be with other children, it's too soon for that. Children have a very difficult time social distancing, and touch a lot of things. So it is not till phase 2 in the governor's order that people may have contact with others outside their household, up to 5 people. So I would say at this time, if playgrounds were open, that would be encouraging that, and could increase cases of COVID-19. So we want to avoid that.
And then the kids take it home for the rest of the family. Commissioner Edwards, you have the floor, sir.
I guess, I hope I can see where this is going, but, you know, our whole society is based on basically the honor system, and we have to allow individual responsibility to come into play here, with parents watching their own kids, with parents bringing, you know, hand sanitizer or that type of thing. I would even advocate that maybe we put a sign up, take your garbage home with you. We do that when they go into unsupervised parks throughout the state. So I would just like to see us move forward and get this done, and recognize that government cannot do everything for everybody all the time. We need some personal responsibility here.
Okay. Anybody else want to weigh in on this? All right, Carrie, thank you. And Jennifer, thank you. And so do you want to wrap this piece up, Romero? Do we give you a thumbs up or down, or what do we need to do?
Commissioner Messer, perspective?
Well, I don't have a concern about opening the parks with following Dr. Yu's advice from a health perspective, but now we're getting into the staffing and all of that perspective that Jennifer laid out, and this is where the difference in park staffing between Lacey and county that Commissioner Edwards is always talking about comes into play. It's not that county parks couldn't be open to the same extent that the city ones are, but maybe we don't have the staffing to keep them appropriately safe and clean, and sanitation. I mean, she mentioned not only social distancing, but the sanitation were the 2 elements. You know, there's 4 parks we're talking about. Sometimes it's useful to talk about, instead of just parks in the abstract, to talk about the real places in Thurston County that we mean. To me, Fry Cove and Deschutes Falls are different than Kennydale and Burfoot. Kennydale and Burfoot are places where they have ball fields, they have picnic tables, they have playground equipment. They're places that people gather. And Fry Cove and Deschutes Falls are parks more akin to the state parks. They're people hike around, you know, throw rocks on the shore at Fry Cove, look at the falls. There's no ball fields, there's no playground equipment, things like that. So I don't know, you know, I'm very comfortable with those 2 more rural parks, opening them under whatever we can manage staff-wise. If we're going to have Burfoot and Kennydale open, but we're going to have playground equipment taped off, I don't know if that was what was proposed. It sounds like Shelley was understanding that to be the proposal. And then how often can we get the bathrooms cleaned? I guess my question, the reason I'm struggling with this is that some of the cities have said, let's close the bathrooms. Like, we don't want dirty bathrooms that we can't clean. They're making that choice with their greater park staff. Dr. Yu's saying, I don't want the parks open without the bathrooms, but we have 1/10 of the park staff to keep them clean. So I'm just trying to figure out how that works in the safest, best way. You know, I've seen signage, you know, go before you go, don't go to the bath, you know, we're not closing the bathroom. So I guess maybe I'll throw this question back to Shelley and Dr. Yu so I can fully understand why you don't want a park open but the bathroom closed if we don't have the staffing to keep it appropriately sanitary.
You mean keep the park open with a closed bathroom?
Yeah. I mean, to me, that seems like the compromise, but I don't want to go against the advice of my health professionals.
Go ahead, Doc. If you have anything to add about that.
It is important that people are able to wash their hands. So I think if I was going in the woods, I'd bring a bucket of water. I'd bring a jug of water so I can wash my hands. I'd bring hand sanitizer. If you don't have a restroom facility and people have to go, they'll go in the bushes. It's not sanitary to leave your whatever in the bushes. I just don't think it's a good idea not to have a restroom. The other alternative would be to have hand washing stations to put up. But
What if they're, sorry to break in, but what if they're only clean 3 times a week? And that's all we can manage.
And they'll be at various stages of needing cleaning, depending on the occupancy of the park.
yeah, I think, I don't know. I mean, Jennifer, we've been able to get by with just 3 times a week at those parks.
In the past, I would say yes, that based off of the funding, that's what we needed to do. I would add, we are prepared, and Carrie has worked out a plan to be able to clean the restrooms twice a day, 7 days a week with a seasonal staff person. Based off of the recommendations that were coming out, it was to frequently clean those commonly touched areas. And so what I was proposing is saying, we are prepared to be able to clean our restrooms twice a day, 7 days a week. And if that meets the recommendations, then we are able to do that. Carrie, that is correct, right?
That is correct. And in response to a couple other of the comments regarding people removing their own trash and kind of being a little bit more self-sufficient in our parks, we currently have, and have for a number of years, signs all over the parks that say pack it in, pack it out. It's kind of an old statement that used to be used by national and state parks. Pack it in, pack it out. The signage that we're prepared to put up if the decision is to open the parks explains to people the suggestion that bring your own hand washing supplies and hand sanitation supplies and so forth. But in concert with that, we could do our restroom cleaning twice a day, 7 days a week. We have our seasonal staff on board, which is limited, but we would dedicate their efforts towards that as opposed to some other maintenance activities like mowing, for example.
I think that's a really, really good compromise, and that would be acceptable to me. I think it would be important as we put out the announcement about the opening of the parks to lay it out pretty clearly what the expectation is of park users, that they really need to. Everybody should have sanitizer in their car. Really, you can't walk to the park. You have to, get in a car and go there, have sanitizer in your car or a jug of water so you can wash your hands. And I agree with Commissioner Edwards. People have to take some responsibility, and I appreciate people doing that, and it is important. But I think that it's a good compromise, and that's it. I don't think I have anything to add. Shelley, do you?
Okay. Then I would say is just from my perspective is I'm not in favor of piecemealing it. Either we open up all the parks or we don't open up any of the parks. And I'm in favor of opening up all the parks. I would mandate that the bathrooms are open for sanitary reasons as well, whether it be men, women, or children. When you got to go, you got to go. And but two of the biggest things that are facing us that are going to be a challenge is, number one, people want out. They need to get out. And so when we open up the parks, they're going to exit the homes and come on out. And that's a good thing. But we're also this weekend, Mother's Day weekend, going to be in the 80s. So it's going to have to come with some type of a public service announcement, signage, whatever, to please be smart regarding still the distancing and the group size limits and such, and pack it in, pack it out. Like Carrie said, I'm glad we have those signs up. But I think we can overcome the challenge of people wanting out and the 80-degree weather. But I'm in favor of opening them up with bathrooms. And I'm very happy to hear that we have the capacity to clean the doggone bathrooms as well. Commissioner Edwards, anything? Final thoughts?
No, sir.
Commissioner Menser, go ahead, sir.
So is it am I right that there's 2 parks with playground equipment?
All of the parks have playground equipment, the ones you mentioned, Commissioner, Fry Cove, Burfoot, Annydale.
So what do we decide with regard to that? I didn't understand what the decision was.
Yeah, that didn't come up.
Are we leaving that accessible, or are we with signage, or are we roping it off like Lacey does?
Commissioner, they're currently ribboned off with caution tape, and there are signs up that say playgrounds closed due to COVID. My suggestion would be that we continue with that if we open the parks, because our messaging that we're using, again, in concert with the city, so we provide consistent messaging, says that group amenities are closed, playgrounds, courts, picnic shelters, etc.
Okay.
Areas
Just wanted to be clear on that. Thank you, Carrie.
Well, it's a solemn reminder to the families visiting the park too. You're out in the park, but this piece is closed, and it's a solemn reminder of the seriousness of it. Commissioner Edwards, anything?
Well, the only thing I would add is the UV, the sun kills a lot of that virus business. I'm all for that personal responsibility portion and not getting too carried away about government doing everything for everybody all the time.
Agreed. So do you need a thumbs up, Romero, from us? What do you need?
No, I think I understand the direction. I also like to suggest that cordon off the playground is a good compromise. Although they just having a yellow ribbon, my words of caution, around the playgrounds is not gonna be preventing parents to bring their children and using the equipment, but at least we're making an effort to make the point of those areas are closed to the public. So we will go ahead and open the parks as soon as feasible. We will prepare a news release, hopefully this week. So we're prepared for the weekend rush, that's my words. In terms of the nice weather, perhaps the citizens may need an opportunity to go out and hopefully enjoy the beautiful area that we have. And but also I like to follow up on some of the comments that Jennifer made. Although the staff has made an effort to have a plan to clean the bathrooms twice a day, 7 days a week. But also what she stated is some other areas of the county will see a reduced level of service. I just want to make sure that we build that capacity, but some other areas, because of resources, may be softened as well.
I'll get to you, Gary, but I want to add, since you brought that up, Romero, Jennifer talked about hand washing stations. Do we need to put up hand washing stations or supplement what we have at the parks, or at least a couple of them?
Again, we'll let Carrie speak to the specifics, but we have been trying to get hand sanitizer in the porta potties that we currently have, and we have been unable to get hand sanitizer for those porta potties currently. We are continuing to try, but to date, we have not been able to get them.
That's a capacity issue of the availability, supply chain?
Yeah, you just cannot find it. It's not available in the market, and probably Robin can attest to the fact that we are searching hand sanitizer options to the whole county when the county is ready to open to the public. And Robin has been very inventive as to how we have reached out to a local distillery. They have changed their production from spirits to hand sanitizer. And those are really the innovative approaches that we need to continue to look. So it is an issue. It's not just that Thurston County, it's just the supply chain for hand sanitizer is greatly diminished because of the need.
Okay. Gary's been hanging on first, right? Go ahead, Gary.
I think we could talk to John down at Sandstone Distillery and get kind of first in line to solve some of this problem. I mean, he's been great about trying to get that product out any way that he can. And I think maybe that could be a solution to that particular problem. But again, this business about waiting sometime this week, I can't go along with that. I don't know why we can't have this in place for tomorrow, for an example. Let's make sure that we've got this done and open as soon as possible with no delays. Everything seems to come with delays.
Go ahead, Ty.
Question for Robin, can the seasonal employee that's doing the additional cleaning, sanitation related to this be, accessed through our CARES COVID-related response funding?
Maybe.
Okay.
We'll look.
Good.
I mean, I want to make sure that we're not, as Ramiro said, we're having reduced levels of service other places, but, hopefully over time we can address that maybe.
So if we had currently planned for seasonal employees in our budget, then the answer is no under non-supplanting. But I will review the specifics and see if we can find a way that makes it fit. And then that will be one of many competing priorities of how to spend that money.
Well, I'm going back to Commissioner Edwards. John Burden with the Sandstone Distillery has been putting out those 2-ounce, 2.5-ounce bottles of sanitizer for about a month or so. And I think it's a great idea if he's a local person doing that. And I'm not sure how many gallons we would need on a regular basis to get those.
Look at Robin, yeah.
We actually, Lucy Mills, Road Operations Manager, purchased
Thank you.
hand sanitizer down there, gosh, I want to say a month ago. So we have been quite resourceful. But we're talking specifically within the porta potties, and they are rented. So that's what we were working on. And as for hand washing stations, we looked at trying to find those for our field staff and have been unable to find any. So.
Okay. Hey, Robin, that was from Sandstone?
No, this is from Heritage Distilling in Gig Harbor.
And how is that, like a 20-ounce? 14?
This is a 750 milliliters.
Yeah,
I'm sure they used their normal bottles.
Wow. Okay. Well, I'll leave all that to the professionals, but I'd like these opened up right away and not wait until we get it done, especially before the weather changes later this week.
We understand the direction. We, like I said, have been working on putting the plan together. It shouldn't take us long to get the signage. We have a press release that needs to go out. So I believe I'm tracking with the direction that the board is wanting to go.
And I would imagine Sarah Gensler with the Olympians taking notes and will help frame this in an article as well, so we can get some social responsibility included in that. Did you have your hand up, Shelley? No? Okay. So we're moving away from that topic unless anybody else needs in. Go ahead, Dr. Yu. No? Okay.
Goodbye.
Goodbye. Thank you.
Thank you, Dr. Yu.
Okay, I don't need to say goodbye to anybody else. Okay. We've been at this for an hour and a quarter, but what I'd like to do is get on with Keely Marino and the homeless strategy, and then take a. Is that all right? Yes, good. Keely, welcome.
Good morning, welcome, or thank you, commissioners. So I just have a brief update today. As you probably know, the cold weather sheltering season ended last Thursday on the 30th of April. However, St. Michael's Parish and Sacred Heart did continue their sheltering services through Saturday. Although those two shelters are closed, Sacred Heart continues to do daily hygiene services out at Sacred Heart in conjunction with Intercity Transit, City of Olympia, and other providers. They're organizing pickups for individuals at Inzen Road and other locations throughout Olympia, and to get them to Sacred Heart to take showers and get food and just address basic hygiene needs. Also and I really wanted to shout out, the Hazardous Weather Task Force, all of the shelter providers on our meeting on Friday made a deliberate shout out to St. Michael's and Sacred Heart this year. Typically they only house 14 single men, and they usually end their shelter season on around March 13th. And this year they not only extended it till the end of April, but they doubled the capacity of their St. Michael's Parish for single men. And they also opened up a women's shelter when it was desperately needed. So all of the shelter providers and other stakeholders on the Hazardous Weather Task Force were just really wanting to show our appreciation for those extra efforts, that mostly volunteer efforts of the St. Michael's Parish and Sacred Heart, and their organizer of those activities, Kim Condrat, who just really knocked it out of the park this year. So then, as you know, cold weather shelter ending also means that Salvation Army's cold weather beds would end on the 30th. And then during a surprise announcement on Thursday, we're glad to announce that Salvation Army, through some donations, was able to extend their shelter 24/7 for the next 30 days. And they're hoping to continue to do so. So although we were not able to move forward on that, they were able to find some resources in order to keep their shelter open and to go 24/7. So we're really, really grateful for that. This is a time where we desperately need extra beds. The providers, there's some providers that also have written a letter to Safe Place to see if they can partner in supporting Safe Place and reopening their shelter. So I don't know where that stands, but it's definitely something that the providers have concerns over, with a 20% increase in domestic violence calls reported by Olympia Police Department, and other providers reporting a significant increase in unhoused and housed individuals reaching out to providers that don't normally get a lot of those calls. So we're hoping that we can partner and support, not we, but the providers can rally around Safe Place and get some more shelter beds for those fleeing domestic violence open. City of Olympia did hire a new homeless response coordinator. Teal Russell, who served as a downtown ambassador for 6 years, was promoted to that position. We're super excited. She is very well familiar with the homeless population throughout City of Olympia, and started last Friday. So we're super excited about that.
And what's the name?
Teal Russell.
Okay.
Yeah. We've worked together very closely for six plus years. So I'm really excited to take on that partnership with the City of Olympia. We continue to work lockstep with City of Olympia. We're meeting now just 3 times a week rather than every day of the week, in order to make sure that we're coordinating all of our efforts, including Ensign Road. So I know that Ensign Road has become a particular hot point in terms of RVs and cars. Keith Staley, interim assistant city manager, Teal Russell, the new homeless coordinator, and other city staff went down and took a survey of all those individuals down there. They have added a portable toilet and a dumpster. I don't think a hand washing station, because there aren't really any available, but they interviewed every one of the folks that are staying down there, got kind of a sense of who they are, and are working on trying to help support them, either to dump any kind of waste that they may have in their vehicle, if it's an RV, and also to help connect them to housing services. Today, in terms of quarantine and isolation, we are doing a tabletop here at ECC to kind of walk through that process and identify any gaps, or so we can make sure that we are lockstep and ready to go. So pretty excited about that. That sounds like actually a fun activity. And that's about it. That's a lot, but I know we're an hour and 20 now in, so.
I would imagine that the Ensign Road RVs came from Deschutes Parkway.
I think some did come from Deschutes Parkway for sure, and others have been. I drive down Ensign almost every day before the COVID-19 crisis, so some of them have been there for a while, but yeah, a lot of them did come from Deschutes.
Okay, thank you, Keely. Commissioners, questions or comments for Keely?
No, sir.
No? Go ahead, Ty.
Comment, Keely. I don't know if you've heard, probably have, but at the meeting that happens between the cities on Friday, the mayor of Olympia has been was trying to sort of resurrect the Carpenter Road discussion, thinking that maybe some of the funding that's coming in related to COVID could be helpful to get it. We kind of hit a roadblock there with all the site prep and expense, and that kind of killed that concept or stalled it out. And she's wondering if any of these new resources could help us get over those hurdles. And I'm just letting you know if you hadn't heard that, because that discussion may get reinvigorated and we kind of go through the numbers again. I don't know where that'll lead, but just wanted you to hear that.
Yep, absolutely.
Go ahead, Gary.
I guess with that topic coming up, I still feel that the homeless situation needs to be centrally located where we, at some point, will be able to provide services, whether that's mental health or addiction services, food services, whatever it's gonna take. And so I am opposed to any homeless camp being set up in the unincorporated area of Thurston County. I just want to put that on the record.
Ty?
Well, if you'll stop saying that nobody wants to go to downtown Olympia, and maybe I will take you up on that.
Although I would add to that comment that the food bank is out east, mental health services are out east, transit systems out east. Takes care of some of that issue, perhaps. Keely, you lit up.
Nope, it was an accident.
Okay. Anything further on the homelessness update? No. Katie, thank you very much.
You're welcome.
And it is 10:25, and before we get into the review of the BoCC draft agenda and our regular legislative agenda and then the commissioner items, we're going to go ahead and take a 10-minute break. 10 minutes, please. So we'll be back at 10:35. Thank you. The agenda setting and work session for the Board of County Commissioners for Cinco de Mayo, May 5th, 2020. And we're going to continue on. We're now going to review the Board of County Commissioners draft agenda for May 5th. Oh, that's today. And of course, the meeting has been canceled. Let's see. So we're going to discuss the review of the May 12th. Oh, Romero. I have to change the view here. I can't see you.
You have been considering canceling the meetings as you go along, considering the extension of the stay at home, stay healthy order by the governor. I recommend for you to cancel the formal Board of County Commissioners meetings, which are scheduled every Tuesday during the afternoon for the month of May.
Okay. Do you need a thumbs up or down, or what do you need?
Yeah,
I would do that.
I'd like to have a concurrence by the board.
It looked to me like we were like phase 3 is where we get to go back to having board meetings. Was that consistent with your reading, Ramiro?
Yeah, that based on my understanding is phase 3, and you heard from the governor, at least 3 weeks, he's gonna wait until each phase is gonna be implemented. So perhaps we might be going beyond May 31st.
Okay.
But for now, I think the decisions we have made is going along with the extension of the state home stay healthy order, and the order currently stays until May 31st.
Got it. So I say thumbs up, Gary?
Yes.
Okay. Well, reluctantly, I get that. So we're going to review the item for May 12th. And first is a proclamation for Nurses Month.
Yeah, so to frame for the audience perspective, just because the board considered canceling the formal Board of County Commissioners meetings, they're scheduled again every Tuesday at 2 in the afternoon. Your legislative actions continue to be. You continue to exercise that. So we have, for the last few weeks, we have reformatted the agenda on a Tuesday morning, in which the first item on the agenda, you review the items and we can advance. You may be considering to take an action the following week. So that's what you have before you, the items that you may be seeing for final consideration for next week. This will give you opportunity to listen to the item today, ask any questions, and staff will follow up, and I will follow up answering those questions and perhaps provide additional information if you need, if need be.
Okay.
So the first item on the agenda, Commissioners, for next week is for you to consider a proclamation. And this proclamation to May is the Nurses Month. And again, I believe this is a timely proclamation for you to consider, considering the health providers, including nurses, are on the forefront in responding to this emergency, COVID-19 emergency. And I think is, at least from my point of view, is just timely for you to proclaim May as the Nurses Month. And for your consideration is a draft proclamation here that it will be circulated for your review and edits. And that is the gist of this item that you may consider next week.
All right. And I don't know if my teammates have had a chance to read it yet, but we'll review it and then sign it. Anything from my seatmates on that? Nope.
Well, yeah, Hutch, I guess I would say there aren't enough accolades to really cover this timely. The county manager mentioned it is very appropriate.
Yeah, it's very touching to see the Blue Angels and I forget what the other group was. Who was it? Thunderbirds doing flyovers, and even here locally in New York, here locally, the fire departments and districts running around supporting and giving props to first responders, to neighbors, and to doctors and nurses and such as well. That's very, but you're right, Gary. Number 2, right away vacation.
Yeah, this is a right away vacation that the board consider early in the year, and this is in the last step. Meaning, and then let me just walk you through, a citizen can probably request the county, to the county engineer, to vacate property that has been set aside for public purpose. In many instances, those deeds of those properties have been given for many, many decades. And one of the elements is, as long as we have not opened for public use, the Board of County Commissioners can exercise the legislative authority to vacate those properties and at a cost. So the process is that the county engineer will assess those recommendations. Then it requires a public hearing, and the hearing examiners concurs or not on this particular request, and eventually comes to you to exercise your authority to agree on this vacation with a caveat that as long as the right compensation is in place. So you consider this recommendation back in January 14, 2020. The hearing examiners considered this vacation and recommended for the Board of County Commissioners to go ahead and process this vacation. You pass a resolution number 15873, and I believe back in February, where you concur with the hearing examiner's recommendation to vacate this property as long as this property is properly compensated. That compensation has been in place, and this is your final action to consider the final vacation for this property.
Okay, go ahead, Gary.
I guess just for clarification, once we vacate this, then the property goes to one of the adjoining property owners at a certain price. Is that right?
Thank you, and that is a good point, because the vacation is not that we surplus to other properties, we usually go to the underlying property owner, so the adjacent property owners will take over that at a cost.
And it will add to the value of their property, which adds to the tax rolls for the
It
tax.
will increase the size and tax, so
Thank you.
this will be for final consideration next week. And I believe Craig Sisson is here with us if you have any specific questions related to this process.
Hey, Ty, any questions? No? Gary?
No, sir.
No, I don't either. Thank you, Greg.
That makes my job easy. Thank you,
Yes,
Commissioner.
sure does.
We had all the maps out and whatnot back in January.
Yeah.
So number 3, resolution and call for sealed bids.
Yeah, Commissioners, for your consideration is to give the authorization for Public Works to go and secure bids for the construction to replace the culvert on Elbow Lake Creek that is along the Peasner Road southeast. This is related to a fish passage. As you may recall, early in the year, you issue a request for proposals to give an outfit to prefabricate bridges. And that was the sole purpose to expedite the process as to how we can do the fish barrier projects. So this is one of those locations that will benefit from that. I think the timing is right. I think the fabrication of those bridges are in place or in the process to be in place. So this particular request is to secure the contractor to go ahead and install and do all the work that needs to be done to accommodate the new structure. So this particular culvert will be replaced with a new 60-foot long prefabricated bridge. And this is this will be funded by the real estate excise tax, but also staff has been very successful in securing outside funding, because as you may recall, and I think Commissioner Edwards has been consistent in saying, how about we leverage this, the real estate excise tax too with other funding, and this is the case. We have been able to secure $80,000 from the Solvent Recovery Fund, and which is awarded by the State Recreation Office, which is the RCO grant. So the approximate total cost of this is $900,000. We have received $88,000 from the RCO, and the remainder, again, will come from the real estate excise tax. Any questions?
No, sir.
Ty, any questions? I do, and I don't know if you can answer this, Romero, or if we have staff on the line. But the comparison-wise, Hunter Passage was massive, and the other fish burial removal that we did behind East Olympia Elementary School off of Rich Road was much smaller, but still good size. Where is this in that scope? Do you have any idea?
In terms of, this is a, let me see if I understand your question. This will be replaced with a 60-foot long bridge structure. Did I answer your question?
That does, yeah.
Okay.
That does. Yeah, perfect, thank you. All right. Number 4, approval of amendment number 14. Department of Health.
Yeah, you have seen this item on the last couple of years, in fact, and this is an amendment number 14 to the State of Washington Department of Health Consolidated Contract. And that is where the federal government gives money to address many programs with the public health department. This particular new allocation is about $650,000. And it's coming from I believe the CARES Act related to the COVID-19 response. There is and again, the $650,000 are specifically related to participate in public health emergency preparedness and response activities for COVID-19. This may include surveillance, epidemiology, lab capacity, infection control, mitigation, communications, and other preparedness as responsive activities under COVID-19. This again is an amendment to secure additional funding from the federal government, and this is just timely as to how we need resources to continue to respond to the COVID-19 emergency. If the board consider approving this amendment, the total contract cost will be up to $4,265,491. And it will be extended duration through December 31st, 2020.
That's nice. Very nice. Any questions or comments from my seatmates? Nope. Okay. Number 5.
Commissioner Messick has a question.
Yeah.
What contract is this adding on to? I mean, the 650,000 added, which gets us to 4.2. What's the rest of that money toward? It's not all COVID related, is it? Or
no, this is an amendment. This is the previous allocation that we have received in the past. So we just bring the additional $650,000, brings the total contract to a larger total cost. So in the past, the consolidated contract funds a lot of activities within. I can probably give you more detail for next week.
okay, yeah, I mean, I just wondered what the general gist of the rest of the contract is that's being added on to. It's a bunch of like sort of foundational public health stuff that we get from the
Online, yeah, that's the right terminology. Yeah.
Okay, thank you.
I can add more if people want. So like we get some funding from for environmental health stuff that Jane Venning does.
Excuse me,
hang on.
Can you then?
Oh, I'm so sorry. This is
more.
Marcia Boyle from Public Health and Social Services. Sorry for just jumping in there and not identifying myself without a picture as well. So
I'm ready to mute you.
the Department of Health provides lots of funding for public health and environmental health activities. So included in there is stuff that Jane Mountjoy Venning does as far as it helps support some of the water work testing and quality that we do. It supports the Nurse Family Partnership. It supports our emergency preparedness and response. There's a little bit of funding in there for Jeannie Knight and our disease control and prevention. They give us funding for tobacco prevention. They've given us some funding for the syringe services. They give us funding for just a myriad of various activities within public health and social services. And so the $650,000, $309 of it is from state funds and $340,000 roughly is from federal funds that they are passing through to us in response to COVID-19. So this is just their mechanism to give us additional funding.
That's great information, Marcia. Thank you very much.
You're welcome.
Anything else, Ty? Gary?
No, sir.
Okay. Number 5 then, interlocal agreement with TRPC for 25 grand.
Thank you, Commissioner. For your consideration is for you to approve an interlocal agreement with the Thurston Regional Planning Council for $25,000. They will support the planning efforts from the CPED staff, that will be the Community Plan and Economic Development, to support the Martin Way Corridor Study Project. And this has been a grant, as you, I don't know if you may recall, you also approved the interlocal agreement with Public Works, I believe, to have a consolidated study with the cities as to how the Martin Way Corridor should be implemented. There is a lot of planning strategies that needs to be part of that, and CPED needs to be part of that conversation. And again, this $25,000 funds some of their activities for CPED. So this is getting funds as opposed to giving funds away.
Commissioner Edwards, yeah, go ahead, Gary.
This is receiving revenue
Yes.
from where?
From the, that's from the Thurston Regional Planning Council.
So they're gonna give us 25,000.
Yeah.
Hard to argue with that.
Yeah.
But again, Jennifer Davis is here if she wants to correct me in my statement.
No correction. This is Jennifer Davis from Community Planning and CPED. That's true. These are pass-through funds from a federal grant or a state grant that come to TRPC and will support our involvement in the planning side of this corridor study. So it's a good thing.
Yeah. Commissioner Menser, anything?
No.
All right. Thanks, Jennifer.
Thank you.
That's going to take us to proclamations and awards, and we're going to move on from that. And advisory boards and commissions.
Commissioner, before you move on, I have another item. They might be coming for your consideration next week, which is not listed on the agenda. This is a brand new item, and this is from CPED. And this is going to be you may recall during the conversation you had on the docketing process, one of the items was the emergency housing. And the board decided not to include that as part of the docketing item, and you would like to consider this emergency housing ordinance that you have in place be approved every 6 months as you move along. The board took an action last year in June, this is coming up for renewal in a year, which is next month in June. So in order for you to consider continue with the housing ordinance, you need to hold a public hearing. So this item that I will be bringing to your attention is for you to consider setting a public hearing for June 9th at 3 in the afternoon or soon thereafter. So chances are that June 9th we will not be able to open the offices, but if we can, obviously we have those meetings, but we'll have to be careful as to how we're going to be practicing social distancing.
Yeah.
So we're going to have to be inventive in terms as to how we're going to have a virtual public hearing, and that is something that that is going to be perhaps part of the next steps as to how we're going to be exercising public hearing for the public to provide their perspective on any particular item. So again, for your consideration next week is going to be for you to set a public hearing for June 9th, 2020. 3 in the afternoon, for you to consider the renewal of the interim emergency housing ordinance.
We got time to figure it out, and we'll make it happen. The public has a voice. We'll make sure they get in and get documented.
Yeah, and I believe other jurisdictions have practiced that. So certainly there's some models that we can go through that. And certainly we'll work with CPED staff just to make sure that we give the public ample opportunity to participate and provide their perspective to you.
Yeah, I know it's a bit early, but will that be, did you give the time? It's going to be an afternoon or evening?
Is at 3 in the afternoon.
Okay. I'm just wondering if it would give more people an additional opportunity to participate because we're doing it as Zoom rather than here at the courthouse.
Yeah.
And or the time of day might be a consideration.
Whatever you like, this is a proposal, considering that perhaps there's gonna be a lot of members of the public that will continue to be at home.
Right. Now I'm going to my calendar real quick. June 9th. Do my seatmates have anything to say about this?
Yes.
Go ahead.
Does this require a 20-day notice so the public can have input during that period of time leading up to this hearing?
That is correct.
So right now, would we set a date so that when they make their public comment, it's counted public comment? I guess I'm wondering, because this is the move afoot to allow for placement of a homeless camp in the unincorporated area of Thurston County. And I do think there's gonna be plenty of input coming in from the citizenry about this. And if they're not able to come in person, at least they would be able to send comment in, and who would they send comment to about this?
Yes, thank you, Commissioner. Yes, if the board considers taking action next Tuesday, it will give us the time to have the 20-day comment period.
Okay.
So we will make sure that on the public notice, we give the public a specific information as to how and they can submit written comments as they have in the past.
Yes.
They're a little more direct, and making sure that those comments will be coming to you when you take a public hearing. Jennifer, anything to add on that?
No, everything you said was correct. There'll be ample time, and we'll have contact information in the public hearing notice and posted on the website for folks to be able to submit their comments ahead of time.
I do have one other question on that. When we post that, it was not very obvious in the past when we did this that this was directly in response to the ability to place a homeless camp in the unincorporated area of Thurston County. Is there any way that I can be assured citizens will be notified, rather than it's just some kind of a legal hearing, that it is directly affecting the ability of a homeless camp placement in the unincorporated area of the county?
Go ahead, Romero.
So the ordinance, the emergency ordinance, does not specifically address that. What it does is allows flexibility to on the land use, and doesn't speak specifically in a specific site, but it does speak in terms of the time and duration extended under this emergency ordinance for this particular use on property in the county. So
I guess what I'm going to ask is that my seatmates make this information available, maybe an expanded bit of information, so the public knows that's what this hearing is all about. Yes, it's about other things, but the reality is it's about placing a homeless camp in unincorporated Thurston County. And I'd just like to make sure that our public notice that goes out clearly states what's coming, so they know. If they agree with it, they can comment that they agree with it. If they disagree, they can comment that they disagree.
yeah, we'll work on that language with staff
Okay.
and make it available to the public.
Thank you.
Very good, but it's not site specific. It just allows unincorporated for something could happen. Okay. Commissioner Vince, or anything? Okay. So that'll be item number 6 then for next week?
Yes, sir.
Okay. Got it. Advisory boards and commissions?
Yeah, Amy is here, and you have attached to your packet. We have received an application from the Hopkins Drainage District Number 2 for an appointment for Thomas Thorning. As you may recall, this is an elected position, and I believe the current commissioner who's serving in that position is resigning. And they have gone through a selection process, and until the next election occurs, the legislative authority has to take an action to appoint this individual. This is a request that we've received, I believe a couple of weeks ago. I have sent that information to Elizabeth. She's currently reviewing, just to make sure that we we give you the legal aspects of this particular request. So this might be coming to you with more detail next week, but I'd just like to bring to your attention we have received this request. Anything else, Amy?
No.
Okay. Ty, go ahead.
Unless there's a legal reason not to, I would want at least our basic form application to be filled out by this applicant. I'm not going to approve anybody just based on a name and an address. I mean, we don't ask for a lot of information, but I do want to at least see the basic amount of information that we ask for.
Yeah, we can probably do that. It's a little bit complicated since this is and again, an elected position. It's not a direct, a confirmation by the board per se on this, on this individual. So, Bob, let me work through that. Just to make sure that we provide the information that you're looking for. But it is a little bit different than the regular assignments that you give in the boards and commissions.
Yeah, and I fully realize that I have not handled a drainage ditch district appointment during my time, so I may be off base on how this process works, and I would welcome education on that.
Yeah, and I believe this is at least and my understanding is my first time as well, so I want to make sure that we have all the information in place.
Well, that's why it's a legal review with Elizabeth. They let us know what the proper process is to get through this. Almost like when we appointed Jeff Gadman as treasurer.
Yeah, it's similar to, because it's an elected position, so it's a little bit different than just an assignment.
Right, Commissioner Edwards.
Did we have a couple of signatures of existing ditch district commissioners that signed off on this recommendation?
No, we just received an email from Mr. Matt Jockman. He's a commissioner from the, I believe he's the chair maybe. It's just a request via an email.
I guess from my perspective, I'd like to hear what the incumbent district commissioners have to say about it. One's for it, one's against it. Give us a little bit of background about what's going on. So kind of like Commissioner Mentzer said, we have all the information that's legally available to us to make this decision.
So, and again, I know that you will going to have a lot of questions, and unfortunately I don't have all the answers to you.
Okay.
Just want to bring this to your attention that we receive a request, and give us some time, and certainly we'll get that information to you at a later date.
Thank you.
And if we could, it'd be nice to have that information ahead of next Tuesday, if that's what we're going to discuss it. Otherwise, it may be pushed out again.
Sounds
good. Give us plenty of time to think about it.
Yeah, sounds good, sir.
A PIO check-in.
And I believe you also received another application, I think is from, for the Veterans Advisory Committee.
Oh, there we go. Fran Beard.
Go ahead.
Yes, this one has been on here. And as far as I know, their April 20th meeting was canceled.
Okay.
And so this one is being delayed.
So what I'm hearing is the Veterans Advisory Board needs to have a meeting where they can contemplate this application, and then they will forward a recommendation to the board. So
Yeah, they were going to meet on April 20th and didn't, of course.
So more to come on that as well.
Okay. And that takes care of boards and commissions. PIO check-in.
Good morning, Commissioners. This is Brian Dominique, Public Information Officer for the board. Just a few quick updates. This week is Public Service Recognition Week. Public Service Recognition Week has been celebrated the first week of May since 1985. We normally do some celebrations. Last year, the commissioners went out to the different offices and departments to meet with staff and give out cookies. But given our current situation with the COVID-19 pandemic, we're not able to do that. So instead, we're going to be producing a short video for staff to say thank you, and that will go out to them this week. And then Public Works Week is coming up. That's May 17th through the 23rd. Our Public Works Communications team is building out a social media package so we can share information about the important work our men and women in Public Works do every day. And I'll give a quick update on our Friday 5 newsletters. So 3 weeks ago, we began a pilot for a weekly newsletter that we're calling the Friday 5. Since then, our subscribers to our newsletters and stories distro list has increased by 41. So we have 421 subscribers right now that receive that straight to their email. We're running this pilot through July 31st, and we'll assess the data and community response to see if it's something worth continuing at that point. And if anyone listening right now wants to receive that newsletter, they can subscribe to receive it from our county news page, which is on our website at thurstoncountylaw.gov. And then just a quick COVID-19 update. Megan, our public information supervisor, she's continuing to support public health with keeping the community updated about what is happening with COVID-19 pandemic. On Friday, a story about domestic violence and the COVID-19 pandemic was released on our county news page. People can find that on our website, and that'll also be included in this week's Friday 5 newsletter as well. And that story also has a good video from our public health director, Shelley Slaughter. And finally, based on the decision today, I'll be working with Public Works on a news release to go out about county parks.
Oh, yeah, perfect. Thank you for that. Gary, you're in the same room. Anything for PIO for Brian?
No, sir, everything's good.
Okay, Ty?
Nope.
I'll tell you, Brian, you and Megan, under these circumstances, are doing very, very good work. Thank you very kindly.
Thank you, commissioners.
All right, legislative update, aside from the OPMA being extended.
Yes.
Anything else?
Yes, yesterday I participated on a Zoom meeting with the shared legislative agenda members, which are the cities, the county, as well as the Port of Olympia, South Puget Sound Community College, the chambers, the EDC. And the conversation was as to how we're going to be defining items that perhaps we may introduce on this special session that we perceive the governor is going to be calling the legislature to convene, whether it's going to be sometime in July and August. You know, the conversation was interesting because obviously I believe if there's a special session, it's going to be something to deal with the lack of revenues the state may see as a result of the COVID-19 emergency. It also may be an opportunity to start bringing some items for the legislators to consider as to how Thurston County been affected as well. So this is leading to a Zoom meeting that I will be participating tomorrow with Senator Hunt, Representative Dolio, and Representative Dolan. And we have highlighted a couple elements, a couple of items that we like to highlight. Is really providing an update on where we are in terms of the impacts of this emergency, COVID-19. Also, we're going to make an argument that perhaps continue to support the current projects that we have already allocated funded to. And that would be the I-5 corridor study. And also I made the point that perhaps we need to engage the legislators in this session to allow the counties flexibility to access some of the restricted funds. And that is going to be at least my conversation with the delegation tomorrow. And as well as that is going to be part of that item is going to be part of the conversation this afternoon when we meet. Robin and I have a conference call with WASAC and all the county administrators across the state. I think this is an item that we'll continue to push, and hopefully we can, two ends, bring in this item to the WASAC, and we can formally request that to the governor and the legislature, and also to our legislators to understand some of the difficulties and the restrictions that we have for us accessing some of the restricted funds. And again, my approach will be not to give us a blanket approach to, this my words, to raise some of the restricted funds, but providing flexibility with some side rails will be adequate, at least for counties to overcome the financial gaps that we have as a result of this emergency. But I will keep you posted as to how the conversation goes, and I'm open for any questions.
All right, questions, Gary?
I guess, I don't know if there's questions as much as concerns or comments. I know I had a discussion with the EDC some time back, and one of their big concerns was the regulatory burden placed on daycare centers throughout the state of Washington, not just Thurston County, and the priority that they would like to see placed on that, because as we get back to the new normal, whatever that is, and daycare becomes a big issue for working parents that maybe both in the family work, it is really detrimental, this hit that's taken, and I believe there will not be anywhere near adequate daycare for families to participate in as we try to move forward. So I think that has to become a very high priority, and I would just ask that my seatmates be aware of it for that future conversation.
No, thank you, Commissioners. That was a very robust conversation yesterday on some of the gaps on childcare when we move into some sort of back to normal. And in fact, I'm reading some of the notes, and yes, childcare is going to be part of the discussions with the legislators tomorrow. And again, I was just highlighting what the county's points will be, but childcare will be highlighted in terms of, some may not survive this emergency as a business. If so, then it's going to be so much smaller businesses that can provide childcare services, and the cost is going to increase as a result of the demand. Then there is an opportunity for the legislators to consider soften some of the requirements. All their business can come online and provide those services. We move into some sort of normalcy after this. So, good point.
Thank
you. To Commissioner Edwards' point, I've discussed it with the chamber and with EDC. And also last Friday at the mayor's meeting, all the mayors in the county, it was brought up as well as a concern. What's childcare going to look like tomorrow or next year? But even on the immediate, what's it going to look like? How are we going to be able to assess those needs? So I think it's apparent it's on everybody's radar as well. So I'm glad you brought that up. All right, briefings, public hearing, decisions pending. Nothing.
You have 7 items.
Well, these are we're coming into that right now then.
Yeah.
So the proclamation.
Yeah, you reviewed this item last week, and the board decided to go ahead and consider this. So for your consideration is to proclaim the week of May 17 to May 23rd, 2020 as Emergency Medical Services Week in Thurston County.
Right. Okay. And so you're gonna read that proclamation, Ty?
Yes, sir. Emergency Medical Services Week. Whereas emergency medical services is a vital public service that provides life-saving and supporting care to the citizens of Thurston County 24 hours a day, 7 days a week. And whereas emergency medical services teams, including emergency physicians, nurses, first responders, emergency medical technicians, paramedics, educators, dispatchers, administrators, and others, give selflessly of themselves for the care and welfare of others. And whereas the members of emergency medical services teams, whether career or volunteer, engage in thousands of hours of specialized training and continuing education to enhance their life-saving skills. And whereas the people of Thurston County recognize the need for and initiated a countywide emergency medical services system in 1974. And whereas it is appropriate to recognize, honor, and promote the value of the accomplishments of emergency medical services teams and the Thurston County Medic One Emergency Medical Services System by designating Emergency Medical Services Week. Now, therefore, be it resolved that the Board of County Commissioners does hereby proclaim the week of May 17th through 23rd, 2020 as Emergency Medical Services Week, adopted this 5th day of May, 2020, Thurston County Board of County Commissioners.
So, how do we get this delivered? Are we delivering it to somebody or some people's?
We'll make sure that we deliver to the Director of Emergency Services, Kurt Harding.
Okay, very good. That takes us to item number 2.
Ayes, goes.
Yeah, and Commissioner Messer, and I think he keyed in a little typo on the proclamation, I believe.
Where is it?
No, I think it's good. I have the wrong version. Sorry, you're right.
Did you have your hand up, Ty?
No, I did the virtual clapping for the first
clapping?
time, but I couldn't figure out how to stop clapping.
The one hand clap, okay.
It just went away somehow.
Gary, did you have anything to say?
No, sir.
All right. Thank you. So moving into number 2, amendment of the professional services contract, the HCP development.
Yeah, you reviewed this item as well, and let me take you back to last week when the board approved an amendment to the contract with the state to secure additional federal grant monies to continue the development of our habitat conservation plan. That action was approved last week. This item is a subsequent item to that, and this is to amend the contract with our consultant, which is the Institute for Applied Ecology, to add $44,312.96 to the current contract for a total of $457,659.10. And again, this money is to utilize the federal allocation to continue with the development of the habitat conservation plan. And I believe Jennifer is still on the line if you have any questions related to this particular item.
Go ahead, Gary.
Just, where's the location of that particular business?
I believe it's in Oregon. Is that right, Jennifer?
Portland, I think.
Portland?
It's in Oregon. I can't remember the city. Chris might know.
Okay, got it. That's good enough.
Okay. Nothing else on that one? I'm ready for a motion.
Move to approve the amendment to contract number 6-14 with the Institute for Applied Ecology to add $44,312.96 to the existing contract for maximum consideration not to exceed $457,659.10. And authorize the Director of Community Planning and Economic Development Department to sign the amendment and any future amendments that do not revise the approved dollar amount or duration of the contract by more than 10%.
Second.
So it's been moved and seconded to approve the amendment to the contract number 6-14 for Habitat Conservation Plan Development. Any further discussion?
Yes, sir.
Go ahead.
This is pass-through money, is my understanding, that's come from the feds down to the state and then passed down through us, the whole, almost $500,000. Is that right? I asked the county manager, I guess. Okay, just wanted to make sure that was in line with everything. Thank you very much. That's good. I'm good.
You're welcome. So all in favor say aye.
Aye.
Aye, that motion carries. Number 3, adding Thurston County Public Works.
Yeah, items 3, 4, and 5 are related to the same item, and these are sequential items for your consideration. This is related to the Highway Safety Improvement Program for the 2020 program. And this is does a couple of things. There is a federal grant, $1.1 million to support this safety improvement program. That does a couple of things, removing and replacing over 8,000 of existing guardrails along Little Rock and Water Creek Road. Also installing over 3,000 of new guardrail along Turner Road, and also installing over 10 miles of center line of shoulder rumble strips along Vale and Rainier Roads. And again, the item number 3 is to add this project on the work program. Item number 2 is to authorize the Director of Public Works to enter into a local agency agreement securing the obligation of $1,197,000 in federal funding And the last item, number 5, is to authorize the Public Works Department to issue a call for bids to secure a contractor to provide the services. As you may recall, you had a robust conversation last week on those 3 items, and I believe I had a split vote on this, 2-1, to bring those items for your final consideration, where Commissioner Edwards voted against it.
Okay. Any questions before we get into the motion? Go ahead, Jerry.
I would just like to clarify, which ones are the rumble strips in rural America? Which one of these?
It's all one of the same.
Well, I mean, we're gonna be making several motions here, apparently, and I'm not gonna vote in favor of rumble strips in rural America.
So,
Do I need to vote against the whole package to do that?
yes, because for instance, the item number 3 is to add this program, these improvements into the annual work plan.
Okay,
Which the program includes, as is mentioned, replacing 8,000 of existing guardrail along Little Rock as well as Wattle Road Creek. The second item is installing new guardrails about 3,000 lineal feet on Tono Road. And the third item of this program is to install 10 miles of center line and shoulder rumble strips along Vale Road and Rainier Road. So it's the program that you authorize on those 3 items.
I guess then I just have to vote against number 3, is that what I'm hearing? Because I'm gonna vote against the rumble strips that are very noisy, noise contaminant, if you will, in rural America. I think what it's trying to do is force an unpleasant environment upon the citizens in rural America. I get a lot of complaints about this, so I'm gonna continue to be consistent with voting against that.
So, Romero, I want to understand that if I vote for this, I'm voting for greatly improving public safety on our roads and also ensuring there's a 500-foot setback from any residence.
And you've heard that from staff last week. They have gone through a study on installing the 10 miles of center line and shoulder rumble strips. They will meet the criteria of at least 500 feet away from any residence.
And we removed a lot of those rumble strips because of complaints received from residents
Yeah, and I
that were
believe,
within that 500 feet.
yeah, and I believe some of those were closer to 500 feet.
Right, okay. Commissioner Messer, anything? Go ahead before I get back to you.
I just want the citizens to know that my vote in favor of this is not motivated by a desire to force an unpleasant environment on rural America. It's based on getting some much needed funding from the federal government for improving our roads and increasing safety.
Gary?
I guess I probably could support this, but I'm questioning the 500 foot because I made a drive around out in rural America and I found many of these rumble strips that were much closer than 500 feet. Can I get an assurance from our public works people that they will eliminate those in the process? Because that factual information that everything was within 500 feet had been eliminated is not correct.
No, I didn't say all, I said some.
You know,
So
well,
clarification.
I would like to have the board agree with me to at least make sure that there are not these rumble strips within 500 feet of any residence.
I see a handful of public works staff waiting on the sidelines just to jump in and answer those questions. Matt?
So before Matt, I want to just add that I understand that 500-foot setback is in code. If anywhere it's out of code, it needs to be rectified. Go ahead, Matt.
Okay. So we will ensure that
Hey Matt, can you introduce yourself because we cannot see you?
I'm sorry, I apologize for that. My name is Matt Unselman, Thurston County Traffic Engineering and Operations Manager. Public Works staff we have evaluated to make sure that all of the rumble strips are more than 500 feet away from homes. A lot of these rumble strips, as Ramiro mentioned, are being installed on Rainier Road, which goes through Fort Lewis property. So there isn't a lot of homes where these locations are to begin with.
Matt, can you address the fact that when we fill previously installed rumble strips, because we have done that, were those within the 500 feet?
Those, we actually, the recommended distance actually used to be 300 feet, and we've increased it to 500 feet now.
Okay, based on the robust feedback.
Oh, go ahead, Gary.
Okay, so I didn't hear an assurance because I can tell you we are not in compliance with the 500 feet. If I bring these to your attention, if you don't find them, which I would think Public Works would come across these, but there's one over next to Military Road and 133rd, I think it is, on a corner right next to somebody's house. So, Matt, can I get a assurance that we're gonna take care of that within 500 feet of people's houses?
Are we talking about rumble strips in this contract or previous contract?
Previously installed.
No, yeah, these are previously installed that have not been filled in and continue to degrade the environment out in rural America.
Can we agree to evaluate them on a case-by-case basis as they come in from homeowners?
That seems to be a good approach. So if we have specific locations, we can go ahead and evaluate that, Commissioner.
As long as we eliminate those under the 500 foot, that's my concern.
So, and we'll evaluate those on a case-by-case basis?
Well, yeah, if it's more than 500 feet, I guess I lose.
Right.
But as long as it's
less than 500.
500 feet is what I'm looking for.
Okay.
So are we been assured that that'll take place?
Yes, sir.
Okay, good enough. Okay, then I'll support the motion.
All right. So is our motion?
You're muted, Commissioner.
Okay, move to approve the resolution to add the Thurston County Public Works 2018 Highway Safety Improvement Program Project, CRP number 61501, to the 2020 Annual Road Program.
Second.
Okay, so it's been moved and seconded to add the Thurston County Public Works 2018 Highway Safety Improvement Program. Any further discussion?
No, sir.
Okay, all in favor say aye.
Aye.
Aye, that motion carries. Number 4.
This is related. I will make the motion to approve the revised project prospectus and local agency agreement requesting obligation of $1,197,000 in federal funding for the Thurston County Public Works 2018 Highway Safety Improvement Program Project, CRP number 61501, and authorize the Director of Public Works to sign the revised project prospectus, local agency agreement, and any subsequent amendments and administrative changes not to exceed 10% of the original agreement.
Second.
All right, the moved and seconded to approve the local agency agreement supplement for the Thurston County Public.
We're making sausage here, just remember.
Any further discussion on that one? Okay, all in favor say aye.
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 Aye, that motion carries. Number 5.
I'll move to approve the resolution and call for sealed bids and authorize the county engineer to set the bid date and time for receipt and opening of said bids for the Thurston County Public Works 2018 Highway Safety Improvement Program Project, CRP number 61501.
Second.
It's been moved and seconded to approve the sealed bids for Thurston County Public Works for this project. Any further discussion?
Only one technical item. Is there any reason that it isn't the 2020 Highway Safety Program? Are we using funds from 2018 program? Is that what this is about?
These were, excuse me, this is Matt again with Thurston County Public Works. These were actually allocated back earlier in like 27 or 2018. And unfortunately, that title, even we were given the funding in 2018, but we're delivering the project in 2020. So that's why you end up with a different date.
Okay, that's fine. Thank you very much.
Good question, though. All in favor, say aye.
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 Aye, that motion carries. Number 6, resolution and call for sealed bids for Thurston County Public Works Reeder Road Bridge.
Yeah, you also reviewed this item last week, commissioners, and this is for you to authorize the Department of Public Works to go ahead and secure bids for the replacement of a structurally deficient bridge on Beaver Creek, just north of Maytown Road. The total estimated cost of this replacement is $1,740,000, where $1,505,100 coming from the Federal Highway Administration, which is a federal funding through the Bridge Replacement Advisory Committee, which is also called the BRAC Committee. There is a requirement for a local match, which is $234,900, which is coming from the County Road Fund. You had a discussion last week. Matt explained in great detail how the bridge inspections go through it. It is a national criteria where we evaluate bridges across the county related to structurally deficient bridges or functionally obsolete, two different criterias. And in this particular case, that criteria meet the requirements of federal grant, and that's why this item is before you.
Okay, any questions of Romero?
No, sir.
Okay, is there a motion?
Move to approve the resolution and call for sealed bids and authorize the county engineer to set the bid date and time for receipt and opening of said bids for the Thurston County Public Works Reeder Road Bridge Project, CRP number 61510.
Second.
It's been moved and seconded to approve the call for sealed bids for Thurston County Public Works Reeder Road Bridge. Further discussion?
No, sir.
All in favor, say aye.
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 Aye, that motion carries. Number 7.
I'm sorry.
Go ahead.
Thank you, Commissioner. Number 7, you also reviewed this item last week, and this is to authorize the Department of Director of Public Works to secure funding, federal funding of $150,000 through the project prospectus and local agency agreement with the state. And the $150,000 federal funding is to conduct a study, feasibility study for trail systems in the Rochester Grand Mountain area. This federal grant carries a requirement to provide a local match. The local match is $23,410, and that match will come from the road fund. The total project cost at this point will be a total of $173,410. And you also had a discussion on this last week.
All right, any questions?
No, sir.
No, Ty? Okay, a motion, please.
Move to approve the project prospectus and local agency agreement requesting obligation of $150,000 of federal funding for the Rochester Grand Mound Trail feasibility study and authorize the Director of Public Works to sign the project prospectus and local agency agreement.
Second.
So it's been moved and seconded to approve the project prospectus and local agency agreement for the Rochester Grand Mound Trail feasibility study. Any questions or discussion on this?
No, sir.
Okay. And I just want to be sure, Matt, if Matt's still on the phone, I believe he is.
I'm still here.
That we're going to actually be looking at, not we, but the county, will be looking at, when it says feasibility, whether we're going to cut through the farmlands or run parallel to the highway, correct?
That is correct.
Yeah, they were loud and clear about that concern. I just want to be sure it's addressed and their needs are addressed, okay?
And the public they'll get to have feedback on any alternatives presented in this study as well.
All right, thank you, sir.
Yep.
Okay, all in favor say aye.
Aye.
Aye. Are you muted, Ty?
No, I said, sorry.
I'm sorry. You guys, when you do it simultaneously, I don't always hear it. All right, that's approved. Aye. Number 8, an ILA for distribution of reclaimed water.
Yeah, you also reviewed this item last week, Commissioners, and this is an interlocal agreement with the lot, as well as the local jurisdictions, and this is related to the distribution of reclaimed water. A lot is our local sewer utility that treats water, and also as part of the sustainable approaches, they have developed a program where they have been reclaiming water for other uses. This particular agreement gives the county an option and an opportunity down the road to access that commodity if need be. So you heard this item last week, and I believe the board is supportive of going with this agreement. Any questions?
Any questions?
No, sir.
Nope. Okay, motion?
Move to approve and authorize the Thurston County Manager to sign the general interlocal agreement and the reclaimed water distribution agreement number 2 between the Lot Clean Water Alliance, Thurston County, and the cities of Lacey, Olympia, and Tumwater for distribution and use of reclaimed water.
Second.
It's been moved and seconded to approve the interlocal agreement for the distribution of use of reclaimed water. Any further discussion or questions?
No, sir.
Nope. Okay, all in favor say aye.
Aye.
Aye. The motion carries. And number 7 is the voucher list.
For your consideration is for you to approve the voucher list of the week of April 20, 2020.
Okay, any questions about the vouchers?
I had a question, just a lot of going through the different items, a good chunk of them were all kind of listed out as U.S. Bank National, and I assumed that had something to do with the way, maybe with the COVID situation, the way we're paying out differently through online or versus cutting checks or something. It just, there was many pages of items that all had the same sort of label in the far left column, and I just wondered if anybody had any insight on that.
Commissioner, do you remember what department and office was attached that expenditure to?
It was a whole bunch of different funds. I mean, it was literally, I could pull it up. Let's see. It just seemed like maybe all payments were getting routed through a particular, not typical.
It seems over the years I've seen a lot of that, so I don't know if it's something new or COVID related.
Let's see. So many emails. Okay, 420. I think I got it. Let's see. Pull it up. It must be in the next week. I'm going to just leave this question. I think it's in the next set that we'll be looking at next week. So I will raise that issue between now and then.
Okay.
I don't see what I'm talking about in the week of April 20th.
Yeah, because you're probably looking at the upcoming week. So if you have any specifics, I'll be prepared to answer those questions.
Got it. Okay.
Next week. Okay.
Okay, so is there a motion to approve the voucher?
Yeah, and I just pulled up 427. So my question relates to next week's, and we can deal with that next week. Okay. So my motion is to approve the list, voucher list for the week of April 20th, 2020 for a combined amount of $1,245,050.02.
Second.
It's been moved and seconded to approve the voucher list for the week of April 20, 2020. Any other questions or comments or amendments, changes, anything? Nope. All in favor say aye.
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 Aye, that motion carries. Now we've got several commissioner items to get through before we end up with an executive session. So I want to be sure we have plenty of time for the executive session. The first one on the commissioner items is IT system replacement. Is that something we have to discuss today?
Perhaps not. This is a follow-up to the item that you decided to put aside related to the upgrade of the camera system on the courts. But Robin has a perspective on this.
I was just going to say that we could take a look at that during the budget work session.
This Thursday.
Oh, perfect. Then that'll save us a few minutes.
And I know that Dennis was just jumping up on the sidelines to give you a perspective. So Dennis, Thursday morning, that will be, if you can participate on that to present this item, that would be great.
That is no problem. I'll make myself available.
Thank you, Dennis. And so that takes us to, we already discussed opening the county parks. That takes us to item number 3, and that's the hazard pay decision. Discussion.
I don't think you can delay this item, commissioners. So as you have exercised your decision-making process, you have allocated hazard pay to 5% to specific groups here in the county, and that has been lockstep with the stay at home, stay healthy order from the governor. And 5% hazard pay, the last action that you took was to award, I believe, the sheriff's office, patrol, corrections, as well as the juvenile court, the correction officers as well there, and the security officers and some functions of the coroner's office as well. That decision ended yesterday, May 4th, which that was the initial the stay-at-home order. So for your consideration today, would you like to extend that this particular hazard pay? Before you get into that conversation, I would like to strongly encourage the board not to extend this, and my recommendation has been consistent related to the budget issues that we currently have and the gaps that we're going to be facing on the revenues. If there's anything that we can reduce the gap, I think the difficult decisions will be a little less difficult if that is the case. So again, there's 5% to those groups for your consideration. And again, my recommendation continues to be for you not to extend the hazard pay to those groups.
All right. Gary, I see your hand up.
I would like to point out that this is not a supplanting issue. This is a direct response to the COVID-19 situation, and the funding that we got from the federal government can go to offset this budgetary hit. And so I am very much in favor of continuing the 5%, I'm going to call it combat pay, if you will, but it's really contact pay for any of those individuals that are in direct contact with potential individuals that could expose them or their families to this virus that we're fighting. So a lot of folks are still on the job, so to speak, but they're not in combat or contact with individuals that could affect them. So I'm very much in favor of continuing this and to keep track of that and then bill it against the federal money.
Commissioner Menzer?
I've been opposed from the beginning. I continue to be opposed for all the reasons the county manager outlined.
All right. And I will weigh in. This hazard pay ends today. Last night?
Ended yesterday, May 4th.
Ended yesterday, okay. And I understand County Manager Romero is advocating against it, as he consistently has, because of, and I won't talk like you're not in the room, because of budgetary concerns, and I greatly appreciate that, with a keen eye on the budget, and especially in light of the COVID, what are we going to do? But I have down on my notes before we began this discussion about the reimbursement, or be able to apply some of those federal funds to that purpose, which might will help considerably if we're allowed to do that. I don't see it as supplanting. And Commissioner Edwards has consistently asked about, well, what are other counties doing? What's everybody else doing in relation to whatever decisions we make. And I don't believe any other counties, unless it's changed, Romero, no other counties in the state are assigning hazard pay to law enforcement or first responders.
The feedback that I receive, and Robin can chime in on the weekly meetings that we have with all the counties across the state, to my knowledge, no county has exercised hazard pay to law enforcement.
And
Thurston County.
okay, and to my knowledge, no one in the city, no cities in this county are doing that either. They're assigning not hazardous pay to their law enforcement or first responders, but it's going to other personnel. And so it's nice to have that information, but that doesn't impact my decision. That's their value judgment, not mine. I'm in favor of continuing the hazard pay for those identified workers that we've already assigned. Until this thing is over, or until the end of the month. If we do it piecemeal like that, is it the end of the month?
That will be the other question, obviously. I have a 2-to-1 to continue with this hazard pay for how long? That's the question.
From my position,
Go ahead, Gary.
From my position, it would be for as long as we're on this lockdown status and we haven't opened up to a new normal course of activity.
And I would advocate at least through the end of the month, because now we'll be looking at the end of the month what the next phase may be, and it may get much better or it may get much worse or stay as it actually says in the proclamation. So I'd like to do it as a step as we go. We can always decide later down the road. So I just like to do it a month at a time. Any input from financial? Does that cause a pain in the neck for budget? I don't mean for budget, but from the financial or the payroll piece.
So this last month has cost approximately $65,000 just for the 1 month of April. So it'll be about another $65,000 for the month of May. I agree that it is not supplanting. It's an additional cost that we did not budget for. However, we do not know yet if the federal funds will cover these costs, but we will be attempting to claim them.
Okay, but doing it a month at a time, is that a burden on the financial folks?
Not on the budget.
But
And
payroll
we
people.
call it a burden. We just have to adjust the payroll system, but we can do that.
Okay. So that's why I'm a month at a time. You want to do it, Gary, until it's over?
Well, I just
I
want
don't know when over.
I want to make sure we do it. If it takes me supporting the month at a time, that's fine as well. Because I think it is a very deserving compensation for a very hazardous duty.
And I completely agree. Romero, go ahead.
I just want to make sure that my recommendation is not about the argument whether that's deserving or not, or whether I undermine the great job the law enforcement does and the exposures that they may have. That has nothing to do with my recommendation. My recommendation, just to be clear, is related to my concerns that I have about the budget, and those concerns have been highlighted to you as well. So I just want to clarify that from my point of view. And also, recommendation, you have been, supporting this effort, and you have been aligning to the governor's stay-at-home order, and that the steps that you have taken in making those decisions. So I recommend, obviously, Student 1 to take this until May 31st, 2020.
All right, thank you. And that's why I started off with saying that your aim was budget related only. You weren't making a value judgment one way or the other, just budget, and I appreciate that. Okay, so you got what you needed from that then.
Yep. Thank you.
Follow up on, I know you're taking notes, but follow up on public testimony.
Yeah, this is a follow-up to the letter that Mr. Pettit has sent to all of us in the last 2-3 weeks. And you received another letter from him yesterday. And this is continued to be related to a contract the juvenile court came to, And based on that information that I provided at that time, the board agreed to go ahead and enter, extending the contract with Hard Strikes, and this is services they provides to juveniles associated with the juvenile court. Soon after that action was taken, it was at 3-0. We received a letter from Mr. Pettit, sorry, stating an argument that perhaps the activities the hard strides are using on this particular property were not permitted. As a result of that, as I reported to you last week, I asked juvenile court to hold and sign in that contract because we received a complaint from a citizen related to unpermitted activities. Over the last 2-3 weeks, we have continued to investigate this matter and have come to a point of back in 2015, I just got a copy of a letter, March 2015, another individual raised the same concerns on this particular property. Perhaps some of the activities were not aligned to what is permitted on this property. So the county did open an investigation on this complaint, and again, that was back in 2015. And they conducted an investigation, and they concluded at that time on the following. And this, it's on March 24, 2015, staff completed a site visit in which time you stated, the owner, that you are providing horse riding lessons to individuals and small groups on horses that are owned by you. A review of Thurston County Land Use Code was completed to determine if the activities are permitted. Based on this information, the activities occurring at your property do not meet the definition of quote-unquote riding stable arena academy, close quote, as defined in Thurston County Zoning Code 2.20.03.040, parentheses 115, and therefore do not require a special use permit. In order to maintain compliance with the Thurston County zoning regulations, the horse riding activity occurring must meet the following. Horse riding lessons may be provided without limit as long as there are 5 or fewer riders at any one time. Riding events with 6 or more riders are allowed up to 4 times per calendar year. That was the conclusion of the 2015 investigation to the similar complaints. We have followed up with the property owner, and what makes it a little bit difficult is we don't know at this point whether those activities continue to be in accordance to the letter issued in 2015. Also, I'm coordinating with environmental health to make sure that we cover all the bases related to the issues that Mr. Pettit highlighted on this property. So this is just an update. At this point, I will have a conclusion to this item. And again, this contract is being put on hold until we get the complaints raised by Mr. Pettit totally vetted. So an update and more to come.
All right, thank you. Go ahead, Gary.
I guess I would have a couple of questions, and I don't know that you'll have the answer, but maybe you can come up with that. When was the original contract signed that there was maybe some RFP? Because I guess there's some other writing thing out there or something, so it does something similar. So I just wonder, where is that original contract and when was it signed that we're extending? So could we get that as part of our information?
Yeah, I can get that.
Okay.
Okay.
So what you're asking is the means and methods in which the original contract was put in place.
Yeah. I don't know much about it, because I think this is something that maybe juvenile court has been working on all along. I don't know that we ever saw a contract come in front of us, so I'm just trying to if you'll remember, way back when this came up, I asked if everything was legal in us moving
Yes.
forward.
So what,
That's all.
so the action that you took 3 weeks ago, you waived the procurement process. That's what you did. That's the action the board did, because you do have the authority to waive procurement processes, bidding process, or request for proposals as you see fit. And that's the action that you took 3 weeks ago, to waive that action.
Oh, okay, I thought that waiving that action was on a contingency that there was already a contract in place and we were just extending the existing contract.
Yeah, but you're correct, because those services have already been in place and provided juvenile court, so you're right. It was
Okay,
an extension to the-
I'm just trying to get clarification, make sure we do it right, that's all.
But I just wanna make sure the action that you took is waiving that procurement process.
Okay,
But I'll get that information.
okay, thank you.
Do you have any other public testimony to follow up on, Romero?
No, sir.
Okay. I'm going to dispense with commissioner items because we need to get into this executive session.
Because we never have enough time.
So I will ask to stay on the line, obviously Robin, Grace is online, Elizabeth, hopefully he can join us. Brian, please leave the Zoom meeting. Bill Richardson, please leave the Zoom meeting.
And myself.
And thank you all.
And Commissioner Edwards unfortunately has to recuse himself from this matter. Brian, please leave the Zoom meeting.
Take it down.